Hello, I'm Al Ali, and I'm very excited that you're going to have surgery done with us. And I really would encourage you to spend some time looking at these videos because they're extremely helpful to your recovery. It's an exciting time for you, and we're excited, and we're here to help you. And I think these videos will help get you there. I'm going to talk to you now about your upcoming thigh surgery. Thigh surgery is a fairly complex procedure, and I really want you to be educated about what you'll be going through. First, I want you to know that it's fairly normal to be nervous when you're going to have surgery. Actually, you would be abnormal if you weren't at least a little bit nervous before surgery. We will give you a set of prescriptions, and I write them on the day that you come in for your preoperative visit, and they will go to the pharmacy that's on your medical records. And I would really prefer that you pick them up before you come to surgery. So on the day that we see you, please pick them up, because after surgery, it's very uncomfortable and inconvenient for you as you're driving home to pick them up, or your loved ones picking them up for you. So it's best to just get them up front. The day or two before surgery, I have you come in and I will mark your thighs for the upcoming surgery. Marking is like a guide to what I do at the time of surgery, where to cut, the places where I need to control things, and it is absolutely necessary. We do that with a pen. It's a fairly extensive procedure for thigh reductions, and it takes anywhere from 30 to 45 minutes to accomplish. The day of surgery, I will see you before surgery. I will say hello, I'll check your markings, I'll give you an opportunity to answer any questions that you still may have. After that, the nursing staff will get you ready for surgery. Anesthesia will come in, they will say hello. They will also have you sign a consent for their part of the surgery. And then one of my residents or trainees will come in and have you sign a separate consent, separate from the one that you sign in clinic. After that, you'll be taken to the operating room. Most people don't remember much after that because the drugs that the anesthesiologists give you kind of make you forget about what happened. And the first thing you'll remember is you'll wake up in the recovery room. Most people are still pretty groggy when they wake up, so you may not remember a lot of it, but you may remember some of it. The majority of thigh reductions stay overnight, but some do go home depending on the extent of the surgery. When you wake up, you will have a garment that will kind of start most of the time below your knees. Sometimes it goes down to the ankles and it comes up to the mid-waist. And most likely you'll have foam over the area that we've operated on. If we've done any liposuction, the areas that we've done the liposuction in may have fluid leaking, and that will leak for days after surgery. Don't be alarmed, that's expected. When you go up to the floor, it's very important that you get up and walk once you're awake and alert completely. The worst possible complication after this surgery is blood clots that can start in your calves, and then they can migrate into your lungs, and that's life-threatening. So the best way we know how to reduce that is to get up and walk. So the nurses that evening will get you up and walking. You have to do that at least once. Now, if you feel great, get up and walk a lot more, but at least once. The next day after surgery, we expect you to get up a minimum of 6 times, 10 minutes each, and we don't want you in bed. Now, we do other things. We use these compression sequential things that contract around your calves when you're asleep and while you're in bed. And we give you a dose of a very low level blood thinner in the evening. But of all the things that we do, the most important thing is getting up and walking that night. Now, when you go home, and you'll go home the next day, you're expected to get up and walk at least 6 times a day, 10 minutes each, as little time in bed as possible, only for naps. So you're either walking or sitting with your legs up, on a few pillows or whatever will get your legs up on a higher level. The day of surgery, the nurses will advance your diet slowly. You usually start with ice chips and see how you're doing. If you're nauseated, if you're not, they'll get you going. Most people, by the time they're discharged the next day, are not on a regular diet, but some are. It just depends on how you're doing. When you get home, we will expect you to avoid certain things. We don't want you to stand for long periods of time. You can stand for 30 seconds or something, But if you're up, we want you walking. If you're sitting, we don't want your legs down, we want your legs up. So we reduce the risk of swelling and difficulties that you may have. And as a general rule, we prefer that you're hardly ever in bed. In bed, it's a pretty good idea to put some pillows underneath your knees to get your knees up to a higher level. Every area that we operate on, we inject with a local anesthetic that lasts from 48 to 72 hours. And I'm going to discuss that a little bit later when we talk about your prescriptions, but that medicine we give you in the operating room. And it's really our main mode of reducing your pain. Since we started using this medication, it's really changed the nature of surgery for us. Patients are just much more comfortable. Hopefully, you're going to have a typical experience with this medication that we inject and have enough reduced pain that it's really quite tolerable and makes it a much more pleasant experience than before we started using this medication. As you progress in your post-operative course, I want you to do a set of things every day and start that maybe the second day once you get home. I want you to lay on a bed that's next to a wall so your legs can reach a wall. First, take your garment off, take the foam off, and put your legs up in the air. And hold it up in that position, hold your legs up in the air for a minimum of 30 minutes. If you have a significant other, a loved one who's willing to massage you from the ankles towards your groin, that's great. Don't go near the incisions, just kind of go from the ankle to the knee, or just don't go into the incision area. And then once you're up there for 30 minutes, then you can put your garment back on. And that's important to reduce a significant amount of swelling. I'd like you to do that early on, a couple of times a day. As you get better and better, maybe once a day after 15 days or so. And you have to continue doing that till your legs don't swell anymore. So it's not only 30 days, if you're still swelling, then you need to do it. When you get home the next day, I want you to get in the shower. So you just wet everything with lukewarm water, no hot showers. And then when you're done, pat dry your incisions. And that's all you need to do. Now I need you to take 1 shower a day for a minimum of 30 days. It's important because it keeps things clean. Also, most people feel more refreshed when they take a shower. So I highly recommend that you do that at least once a day. I don't want you to be in a bath, in a pool, or seawater. I don't want you to immerse in any fluid. That's not acceptable. You can be in water running over you like in a shower, but not immersed in water. That can increase your risk of infection significantly. And you have to ask me in the follow-up visits when you can go into water. You're welcome to use any soap that you like. I would just prefer that you don't use soap that's heavily scented. So if you have any soap that's hypoallergenic, that would be great. There are some soaps that are just there to reduce bacteria. You're welcome to use those. Just anything that you're not allergic to is okay. And you can put them on the incisions, just don't rub them. We don't have any external sutures or stitches. The only thing that we have is towards the groin, we have a few metal clips which will stay in place for a couple of weeks. We'll take those out in clinic. But I want you to shower at least once a day for the next 30 days. And you can coordinate that with the exercise where you put your legs up in the air, so you can do those together. I'd like you to avoid strenuous exercise or heavy lifting for a minimum of 3 weeks. If you don't know exactly when to stop doing that, just ask me when you come to clinic. Your legs are gonna hurt, but you must walk. It's very, very important. You kind of have to walk through that. The local anesthetic is great. It helps you tremendously, but you have to get through some discomfort, and that's kind of important for us in general. As far as driving goes, you are not allowed to drive if you're taking any narcotics. So if you're taking the tramadol, you're not allowed to drive. That's like drunk driving. You're not allowed to do that. Hopefully you're not taking any. The risks that you have with driving are not so much related to the surgery, they're related to safety of driving. So your guide as to when you can drive is when you can perform emergency maneuvers without hurting. For the legs, it's mostly going from the accelerator to the brakes, but sometimes even turning the wheel can hurt you. So you basically get in the car, try those things out while you're sitting in the car with the car not moving. And if you hold back, then it's not time. It varies tremendously from individual to individual. Some people reach that level in a couple of weeks. Some people take 3 to 4 weeks to reach it. But basically, you can guide yourself as to when you can go back to driving. What are those 4 pain medications other than the injectable material that we use in the OR? First, we use high-dose Tylenol. Second, we use gabapentin, which is a direct nerve pain reliever. And then the one before last is we use Celebrex. Celebrex is very much like Motrin, but it's a longer lasting medication. And I know some bariatric surgeons don't like you to be on that drug or that class of drugs, but we've had some pretty good success as long as it's a short period of time while you're recovering from surgery. The last medication that is a non-narcotic is a steroid that we use. Now, this steroid is a pack of 6 days of steroids. You start out with 6 pills, then the next day it's 5, 4, 3, 2, so you decrease each day. The way steroids work is they reduce inflammation and they also reduce swelling, which is an indirect painkiller. So we would like you to take that. All 4 of these work on different mechanisms. So you could take them all together or you could take 1 or 2, but except for the steroids, I'd like you to take that all the time. The other 3, you can alternate or not use them or use them as needed. The last medication that we use for pain, and I really discourage you from using, is a narcotic called tramadol. We only give you 10 pills and we won't give you another refill on that. Narcotics have some pretty bad side effects, and in particular, in the kind of surgeries that we're talking about, it can cause significant constipation, so much so that you have to go to the emergency room. So we prefer that you don't use it. Only use it if you absolutely have to. Now, if you're gonna use it, we also give you something called Colace, which is a stool softener. Please use both of those together. Definitely if you use the tramadol, use the Colace, it'll help you. Now, if you do anything else that helps you move your bowels, please do that. Whether it's drinking coffee, certain foods that really get you going, but we really want you to have a bowel movement as early as possible. Other medication that we use is related to the fact that we don't use drains on anything that we do. It's a very mild diuretic and it's called hydrochlorothiazide. The short term is HCTZ. It's a very low dose of this medication and it gets rid of fluid from your body. A lot of the pharmacies will ask you if you have hypertension because it's usually used for high blood pressure. It's not being used for that in this particular situation. It's just to reduce fluid from your body. People tell you to drink a lot, very large amounts of fluid after surgery. We really don't want you to do that because what happens after surgery is all that fluid will go into the area that we operated on. It can cause fluid collections, which are called seromas. So we want you to drink, stay hydrated, but only enough so your mouth is not dry. And this medication will be the one that you'll be using the longest. It's for 30 days after surgery. The last medication that we will give you is something that helps you reduce nausea. It's called Zofran, and you only take it if you're having trouble with nausea. Again, all of these things are going to be at the pharmacy, and please pick them up as soon as you can prior to surgery. The patient information sheet, which you probably already have, we will give you again in the preoperative period, and it really has pretty much all the information that's included here in this video, but we just want you to have it in written form. You can refer to it, and it's a very good source of information for you. If there are questions that are not answered, please don't hesitate to contact our office.